program for nurses. And we have started the program 3 months back, and today we have successfully reached the program with the last session. I'm really proud of College of Nursing to successfully held this program, and I hope that nurses gain a lot of knowledge uh, and they can work as a diabetic educator henceforth. Today we have with us our eminent leader, our Dean and Principal, College of Nursing, Dr. Nilima Mure with us. I request Madam to speak or to give us or give a guideline or to guide us more about the diabetes educator program.
Can you hear me?
Yes, ma'am.
Yeah, ma'am.
I
Clearly we
don't
can
think this is time for guidance. I think this is time for appreciation because
Yes, ma'am.
all of you have done marvelous job. First of all, I would like to thank Eco India, and I hope Pooja ma'am will convey my feelings to the whole
Yes,
team.
ma'am. Yes, yes.
Mr.
Definitely, ma'am.
Albin and also Anila ma'am. And we are grateful and thankful to them for this platform that they have created for us. This was the first time that we have conducted eco sessions along with Eco India. And I'm sure my team will say that it was a wonderful experience, something different, something very, very new. So we are grateful to Eco India, and I hope this association will continue in future. Because diabetes is the current issue and need of the hour is to educate nurses. And especially, I'm happy that my team conducted these sessions on self-management, which is much required. So I think the credit goes to Dr. Pravindani. He was leading the team and the whole of MedSearch department. I know personally how busy you all are with NAC preparation, but still you took this as a challenge and you have done a wonderful job. So keep it up. And I'm thankful again to my team, Eco India. The collaboration worked very well. And I hope the staff nurses were benefited. So even grateful to all the staff nurses. I know how busy they are, but from their busy schedule, they took time out for learning and attending all these sessions. So continue to upgrade yourself and all the very best for the future, and really appreciate the hard work and everything that was well organized during these sessions. So well done, Dr. Praveen, and the entire MedSearch department. Keep it up. Thank you.
Thank you. Thank you, madam. Thank you for those encouraging words. Actually, it is because of your guidance and support like we could do it. And definitely with a proper team management. I must thank Vishal sir and all medical surgical nursing department teachers, especially Nikita madam, Shilpa madam, and all those who were working as facilitator. And special thanks to Eco India. Just now I had talked with Albin sir also. He said you can continue the same programs. It's not like after Pune, Sangli, Mumbai. Okay, even separate colleges can start these programs. And definitely next time, what like even just now I had talked with Albin sir. He said all eco programs can have credit points by Maharashtra Nursing Council. So maybe next program, what we'll do, we'll try to have credit points. Let it be for 10 hours or even 5 to 6 hours. So we'll try to get credit points from MNC so that it will benefit to the staff nurses. Okay, so again, thank you, Madam, Eco India project, Pooja Madam also. I think initially only for few sessions, Alvin sir was there. Afterwards, Pooja Madam guided us and she was the leader from Eco India. Thank you all the participants also, especially nurses, staff nurses from Pune, Mumbai and Bharati Hospital, Sangli. And today, like we have not finished today, there is one more session by Swati Madam. And after that, case presentation. And all thanks to the case presenters also. Thank you very much. And then I ask Shilpa Madam to proceed further. Thank you, Madam.
Thank you, madam, for the word of appreciation, and thank you, Praveen sir, also for giving us chance, opportunities, and knowing us more about how to make a nurse educator and more about diabetes also. I hope each nurse is going to become a good nurse educator, and also sir said that we are going to give more credit points henceforth, and each college can have this program, which is really very essential. Today we have with us. Mrs. Swati Madam, Swati Kurane Madam, and she will discuss about diabetes self-management education. Diabetes self-management education is a management which a nurse or a patient can do by himself. So she's going to talk about the same, and I welcome Madam Swati, and she has taken her precious time to give us this lecture to discuss upon this topic. Madam Swati has done her BSc from Miraj Medical Center, Maharashtra University of Health Sciences, Nashik. She also has done her MSc from Bharati Vidyapit, deemed to be University, Pune. She is doing her PhD. She is a PhD scholar from Bharati Vidyapit, deemed to be University, Pune. And she has 15 years of experience in teaching and clinical side. She is a research guide for PG as well as UG students. She is working at Bharati Vidyapit Deemed University right now, and she has started working here since 2016. She has published 12 research papers in national and international journals, including Scopus, Web of Sciences, and UGC listed journals. Swati Madam also has published 4 books, chapters in nursing textbooks by international publishers. She also has peer-reviewed 52 international research articles, which are verified by Web of Sciences. She is a resource. She was a resource person for national conferences. She has worked as an examiner, paper setter, evaluator, and moderator for various deemed universities. She has presented and attended various research papers at national, international seminars and also conferences. So we see that Madam Swati is such an eminent professor, and and we look forward for her lecture. And I welcome Swati Madam once again, and I hope she gives us a very knowledgeable lecture. So I welcome Swati Madam, and I hand over the further session to her. So welcome, ma'am.
Yes, ma'am. Yes, ma'am. Thank you so much, Shilpa ma'am, for your wonderful words. Thank you so much, Principal ma'am. Thank you so much, Praveen sir. Thank you, everyone. So I take this is an good opportunity from which provided by Eco India, the organization team and all. So I thank them also because of them we can understand or we can learn something from the good things. So I really appreciate from Eco India team is very good learning platform to everyone and each of us. So thank you once again. So today I'm delivering one lecture that is diabetes self-management education. So shall I start? Can you see my PPTs?
No, PPT is not seen. You can start. You have to share
Can
PPT.
you just a minute, sir? Can you see?
Yes, ma'am. Yes, ma'am. Make it as a slideshow.
Yeah. Yes, yes. Can you see?
Yeah, ma'am. We can see your PPT. Yes, yes. Now it's visible.
Okay. So today I'm delivering this lecture that is a diabetes self-management education. In short form, you can say DSME. So this is very important thing nowadays because in a population, everyone in a family, every person is carries this disease condition. And basically this disease condition is from metabolic disorder. So we should understand what is a diabetes self-management education. What exactly this program or is this training program means actually what is that? So we should learn by this small PPT is just I I have done these PPTs in a very short and with the picturization, so you can understand very easily. So shall I start?
Ma'am.
Am I audible?
Yes, ma'am.
Yes, ma'am.
Okay. So first we can see the learning objectives. What are the learning objectives of this DSME? The first learning objective you can say that is what is the DSME? DSME, the full form is Diabetes Self-Management Education. So how DSME works? So we should know how it runs, how it works. Then after, who will provide this program? Yes. Then after, why DSME is very important? Why? Because of why. The why question has come up. So why it is important? The next objective you can see here, benefits of DSME. What are the benefits which can help to the patient as well as the family members or community or society? So they should get benefited from this DSME program. Then when to provide DSME? This is the actual time when to provide DSME program to the client. Then after you can see here, that is a DSME framework. So what are the frameworks? Which contents included in this framework? What are the contents which leading the DSME program? Then after you can see the how is DSME delivered, to whom you are giving this session, to whom or how. So these are the simple learning objectives you can see here. And then the last one objective, I think that is barriers, strengths, and weaknesses. So every coin has a two sides. There is a benefits, there is a problematic situation also is there. So learning objectives you can see easily means DSME program, how it runs, who can provide this program, then what are the benefits, framework, and then deliver to whom. So this is the basic objectives for this diabetic self-management education. The next slide, you can see here there are certain cornerstones of a diabetes management. So you can see here in a red mark, diabetic self-management education. This is the one of the cornerstone. There are many cornerstones, means 7 cornerstones are there for a diabetes management. First, medical nutrition therapy. This is again one part of the self-management care. Along with this, diabetes self-management support, education on physical activity, guidance on routine immunization, psychosocial care, counseling on smoking cessation. So these are the 7 cornerstones of a diabetes self-management care. But this is today I'm going to deliver this lecture that is diabetes self-management. That is a one part of this. You can see the medical nutrition therapy, along with this many things available on the net also. You will have a separate session on each cornerstones. But today we have just see the diabetes self-management education, what it actually. So what is a diabetes self-management education? The definition you can see here, diabetes self-management education is the ongoing process. Is the ongoing process. Ongoing process on facilitating the knowledge, skill, and ability which necessary for a diabetes self-care. So what exactly it is? So DSME, it is ongoing process. 3 words are very important here. Ongoing process, that is, which is not a stoppable process, or you can say it is a continuous process. It is a long-term process. It is a lifelong process. You can say this is a continuous ongoing process of facilitating of what? Knowledge. First thing, knowledge, skill, and ability, and which reflect on the diabetes self-care. That is very important. This is the basic definition of a DSME. That is, this is an ongoing process which facilitate the knowledge, skill, and ability. So 3 words are here. Knowledge, everybody has knowledge nowadays. We cannot say nobody has a knowledge. Everybody have a bit knowledge about the diabetes. Everybody. Or you can say the people or client, they can search on Google and then they can come to the hospital. They know, they have that ability to take the knowledge by the internet and mobile data, everything. So knowledge they have, but what about skill? They should have a skill also. The skill and ability. Ability here, I want to tell you here, ability means what? Exactly, if the person is suffering with a diabetic foot. So this DSME program, they should arrange the lecture, or they should give the exercise depending on this personality. Means if the diabetic foot person is there, so how you will run the DSME program? What kind of exercises you will provide? This is very important. So only knowledge and skill is not important. Along with this, ability also is very important. So three things are here. I consider here, that is ongoing process, facilitating the knowledge, skill, ability. And these three things which can help for diabetes self-care. Along with this, here I mentioned some objectives. Which are they? So objectives of this decision-making, self-care behaviors, problem solving, active collaboration, and improve clinical outcome. So here problem solving approach, self-care behaviors means, first, a diabetic person, he should accept the things that he is suffering with this condition. So he has to accept the things. That means this is not a curable disease, but we can prevent the disease. So this is very important. Self understanding, our self behavior or self esteem, or you can say thinking power or thought power. He should understand, I'm suffering with the diabetes and I have to get cured from this disease condition, but this is not the what you can say, this is not a curable disease, but we can prevent this disease and the complication as well as. Okay. Next, ongoing DSME means what? Activities that assist the person with diabetes in implementing and sustaining the behaviors needed to manage his or her condition on an ongoing basis. So three things again I have mentioned here, that is behavioral, educational, and clinical. So behavioral, just now I have said, that is, it is self-understanding, that the person, the client, he should accept the thing, that is, I'm suffering this disease condition. So if you confirm diagnosed with the diabetes, then you have to take you have to take what to say, you have to show to your consultant doctor, then physician, and you have to take medicines from them. So behavioral is very important. In that behavioral, you should understand the things. Which are the things? Self behavioral means what? He has to accept the things, that is he has suffering with this condition. Acceptance is very important. Then educational, he has to go to the consultant. Then after educational, the clinical, what does it indicates here? Clinical means you are suffering with a diabetes, you are getting treatment, you are receiving treatment, you are following everything, diet, exercise, everything you are doing. But what about clinical indicators is nothing but the investigations. You should understand the value of investigation. You need to you need to give your blood sample, or you have to check your blood sugar level in the month wise or week wise. You have to maintain all these things. Okay, so these are the clinical indicators which we can include in the activities of ongoing DSME program. Next, why DSME is necessary? So it is very important questions here again. Traditionally, knowledge-based diabetes education is essential, but not sufficient for sustained behavior change. As you can see here, traditional means previously it is a knowledge-based diabetes education. We can
Hello, ma'am. Hello, ma'am. We are not able to hear you.
Yes, am I audible?
Yes, now okay.
Yes, am I audible?
Yes, madam.
Yes, okay. So traditionally, it was the knowledge-based education, diabetics education. It is essential. We cannot say it is not important, but it is essential, but not sufficient for sustained behavior change. Just now I have said Sustained behavior change means as a diabetic person, he should understand I'm suffering with this condition and I have to get cured. That the self-understanding or thinking process you have to change and you have to accept this disease condition. Then only it will work. Otherwise, it won't work. Then after more than 95% of a diabetes, care is done by the patient, right? Very important thing, because in the society you can say, or just now I've said, in everybody's family, one person is suffering with the diabetic mellitus, this condition. Okay, so more than 95% of diabetes care is done by the patient only. We cannot do anything. We are giving only health education. We can provide them diet and exercise. We can tell everything. But the person who is suffering with this condition, he has to take care of himself. This is very important. Again, for three things I have mentioned here, that is outcome-driven practices. That means he has to understand what complication will be occur after if I'm not taking proper treatment or proper what to say, if I'm not working a physical activity, or if the person is having any smoking cessation, any smoking problem, then tobacco chewing or other bad habits. So we have to stop there. They have to stop there. And then patient-centered goal should be there. Patient-centered goal here I mentioned here because he has to take care of himself only. Family members are there, but as a person, if you want to get cured, you have to think about yourself, because this is very important, and this is a silent killer disease condition. You just now I have said this is not curable, but we can prevent. So patient-centered goals should be there. And then after what, facilitating behavior change. That means we have to control all these things. Means you have you have to quit smoking, alcohol consumption. Then you have to maintain your weight also. So these are all the things which are very necessary to take care of himself. So this is for this purpose, this DSME program is very important and it is very necessary. Then after, you can see here how it is different from patient education versus DSME. Means exactly what? Here I just want to mention, patient education is nothing but the health education, you can say. Yes, patient education versus DSME. So why? Both the things are very necessary to the patient. But DSME, how it different from the patient education, or you can say health education. So DSME here, it encompasses the complex array of knowledge, skill, abilities needed to maximize effective self-management. Again, the definition has come here. Again, the array of knowledge means assembling the knowledge, skill, and abilities which need to maximize the effective self-management. This is the difference between the patient education and the SME education. Patient education is nothing but only simple transfer of information. For example, if the diabetic patient is in the ward, and as a nurse, what we can do? We just give the health education to them. Don't eat this, do exercise, quit your smoking. Only we are transferring the information to them. But the different part is here in the DSME program, it encompasses the complex area of knowledge. Complex area of knowledge means assembling the knowledge, skill, and ability also. The three things comes here again, knowledge, skill, and abilities, which can help maximize the effective self-management care. Means they can do self-care management at their own risk, and they can have the understanding I should get cured from this disease condition. So this is the difference between patient education or health education, you can say, versus DSME training program. Now the framework is there. Framework, I included the many things here. In the framework, healthy eating habits. As a diabetic person, what to eat, what not to eat, you should know. This DSME educator, they can provide good knowledge about dietitian. So healthy eating habits, you have to follow the habits also. According to with these healthy eating habits, you have to be very active. Means you have to do exercise. Physical activity is very needed. After that, monitoring your blood sugar level. If you are taking good diet, if you are following exercises also, and then after monitoring also your health checkup, means follow up health checkup, whatever it is there. So monitoring blood sugar level is very important. After that, taking medicine. If you, for example, your blood sugar level is high, in the fasting blood sugar level is high, so what you can do, you have to take a medication as prescribed by the doctor. Yes or no? So this is very important thing. If your blood sugar level is high and still you're not taking any medicine, so what will happen? The problems are there, the complications are there, but you have to understand what exactly has been done. So this is very important, taking medications. After that, if any complication has been occur, what you will do? You have to take care of yourself, then you have to take medicines properly in the morning, evening, whatever the time is allotted. So you have to take medicine. Then problem solving approach. Okay, this blood sugar level is high, so I have to take medicine right now. So problem solving approach is there. Then after what? Healthy coping. So you have to take this disease condition, that is a healthy understanding should there. Because of what? If you are not taking healthy, so automatically, as I said before, this is a silent killer disease. So you cannot do anything. Mentally, you have to be accept this disease condition or coping mechanism. Then only you can reduce your complications or side effects of this disease condition. This is the smallest thing which I can include in the framework of DSME program. Then after, how DSME benefits? What are the benefits of this program? Okay, so here I mentioned this DSME outcome continuums. These are the 4 phases which are very important: immediate phase, intermediate phase, then post intermediate, and then long term. So immediately what you will do at the diagnosis, what you will learn? You have to learn the things. Yes, this is immediate. Then after intermediate, what will happen? The behavior changes are there. In the behavior changes, you can follow all these things. You can see here healthy eating, being active, taking medications, monitoring blood glucose level, problem solving for healthy coping, reducing risk factors. So this is the intermediate phase which we can change in our behavior. Then after post intermediate, what you will do? Clinical improvement. What clinical improvement are there? So clinical improvement in that clinical indicators are there. Indicators in the first, you can see here HbA1c. You have to check HbA1c regularly. After three months, you have to take investigation, give the investigation in the laboratory. Then after, you have to monitor your blood pressure level as well as lipids, and then you have to manage your weight also. So these are the clinical indicators which we include in the post intermediate or clinical improvement in this phase. Then after what? Process measure. Process measure means we all know in the diabetes, we have a many complications like retinopathy, neuropathy, all this. So for this process, we need to have eye examination. It's very important. Then foot examination is very important. Then other measures are smoking cessation. ASA means aspirin use. If you are taking aspirin, you have to see what the aspirin drug is acting. If the person is smoking, continuously chain smoker is there, then definitely he will have complications with the heart diseases he can have. So this is the knowledge which DSME program or DSME educator, they can provide this knowledge, this kind of a knowledge. Okay. Then after pregnancy, pre-pregnancy counselation is very important. So these are the things which we in clinical improvement or post-intermediate phase. Then after, long effects are there. You can say after taking all this condition, knowledge and skill, then behavior change, under behavior, healthy eating, manage your physical activity, then glucometer monitoring, everything if you follow, then automatically you will go to the next procedure or next step, that is a clinical improvement. Definitely the person will think about himself. He has to take investigation, has to maintain his or her weight, then lipid profile he should have, and the knowledge automatically, if the educator is providing the knowledge, definitely they will think about these things which which they can improve themselves. Then after improved health status, what could be the improved health status? So here I mentioned overall health status, it is improved. Then after quality of life, definitely if you follow all these things, definitely you will have a good quality of life. Then days lost from work or school. Here I want to mention is if the child is there, juvenile diabetes is there, if he or she follows all these conditions or phases, so definitely the absenteeisms are very less in the school also. So that is a particular thing which I have mentioned here. Days lost from the work or school, as well as adult person, if it is working condition, he managed good health status because of this, following all these conditions. Then you can manage your diabetes complication. Just now I've said the neuropathy, retinopathies are there. So you have to know and you have to definitely manage the complications even more. Then after healthcare cost, definitely if you follow all these things, definitely the health cost will be reduced. So this is your improved health status. But for this condition, you need to follow all these things, and you have to do all these things regularly, not only for just sake of name. Okay, I'm fine now. Why to take medications? Why to go to doctor? No need to go to there. I don't have a medicine. I don't have the facility. You cannot say, because this is a silent killer disease, and you will have the many problems with this condition the later on if you're not taking treatment, then only. Then after, what are the benefits of a DSM? So there are certain benefits. Because of this, only will come to understand what is diabetes complications, your lifestyle behaviors you can improve, healthcare costs will be improved, then quality of life you can improve. Then automatically, if you have a knowledge, then definitely you will go for the investigation annually, or 6 months, after 6 months, after 3 months, you can do the investigations also. So these are the benefits which we can provide by the DSME educator. How should DSME be delivered? To whom? To whom we are giving or providing this DSME education? So you can see here in the picture, first, that is interprofessional team and peer education. So in this first peer education, what exactly it is? So peer education means same disease conditions, people or client, they can come together. In the community, if you go in the community, the people, those who are suffering with the diabetes, they come together and they sit together and they talk with each other. What happened exactly to me and what happened exactly to you? What are the complications to you and what are the complications of mine? They can talk with in a very good communication with them. This is the peer education is very important, and they can talk without any hesitation. Because the peer group is there, means similar disease condition they are having, and they are talking with each other, means there is no any hesitation, there is no any what to say, there is no any uh, we can say no any hesitations only. So what I mean to say here means they have to have understand or easily talking or easily communication is there in the peer group, because peer education is very important in this condition, interprofessional team and or peer education. Then after, you can go for personal contact with the healthcare workers. So here the client or the person who is suffering with the diabetes, they can directly contact with the healthcare professionals. So this is again one of the method you can deliver the education. Then third one is combination of a group and individual sessions. Okay, fine. So combination of groups is arranged. 5-6 people comes together, and you can give the educations or DSME educations to them, as well as you can give the individual session. One by one, you can give the education to them. Then after, fourth one is a combination of didactic and interactive session. Combination of didactic means didactic is nothing but the instructions. You have to give instruction. As a DSME educator, you have to give instruction and interactive session. You can be arranged for the diabetes patients. So this is these people, they can deliver the education to the diabetes patient. These four things are very important. Now, group-based education advantage What does it mean? So here, facilitation of discussion and support from others facing the same challenges. Just now I explained that is a peer group. Peer group, what happened exactly in that? In the peer group, the same patients, they are in the peer group. So they can talk very nicely, freely, without any hesitation. They can talk with each other. They can share their knowledge. They can discuss with this disease condition. So facilitation, this is the, because of this discussion, they only come to understand, okay, you are cured, no, then I will be cured in future also. Means they have that kind of a confidence, you may say, confidence is there. So because of this, what will happen? You will reduce your time. And if the time is reduced, what will happen? The time for the provision, more detailed information. For educator, they will, if the person is understand first only in the pure education, then definitely it would be helpful for the DSME educator people also, because there will be the more time for provision of detailed information. And then what happened? Because of detailed information, decrease the time demands of health workers, because they don't want to tell anything about regarding the diabetes and all, because already they gave more time or more detailed information to the disease diabetes patient. Then after what? Essay incorporation or families and the families and caregivers. It will be the easy for the family members and those who are taking care of the diabetic patient. So this is group based education. These are the advantage, few advantage because of this education. So again, peer support, exactly what does it mean? Peer support in that use of peer facilitators complementing health professionals rather than the replacing them. So it is not like, just now I've said, it is not like that they don't want to come to the healthcare professionals. They understood in the peer group education. Like, it is not like that. You cannot replace them. But before that, without hesitation, the communication is very free with the peer education group. So that is what this is important. Then ongoing support practically and emotionally also. If you get the knowledge before in the peer education, it definitely it would be very helpful for the patient for practically and emotionally also. Okay, in the emotionally, I want to give you one example. That is what, if the patient is having diabetic foot and he has been done with the uh, uh, amputation, so what will happen? And the person still he is alive, he is carrying his medicine nicely, he is doing his work nicely, everything is good. So what will happen in the peer group? The next person automatically emotionally very strong, because if the person is a diabetic foot and amputation is there, still he is alive, he's healthy now, he is taking care of himself. Then why not me? So this is very important thing, ongoing support in that. Practically, they should understand and they should see the problem, exactly what actually has been done with the amputation patient. And emotionally, they will be emotionally very strong then after seeing the amputation patient. Okay. Then after what? Non-hierarchical and reciprocal relationship. Just now, because of in the peer support in that, the people, diabetes people, they talk with each other very freely without any hesitation. Since if they don't know anything, if they don't know each other, still they are sharing very nice ideas with them. How, when, if it will be possible, when I'm cured or not. Means many questions are there in their mind, but still in the peer group, they will have a free communication with each other. But what happened exactly in non-hierarchical and reciprocal relationship? Might be they will have some hesitation, how to talk with the doctors, how to talk with the healthcare professionals. My questions are very small, my questions are very silly, then how I will ask to them, then how come I will talk with them. So this is the some relationships may be affected. So peer group education is very important. Then after what? Sharing the knowledge, life experiences and common illness experiences are very important. Because of them talking only, freely talking and communication, they will share it and life experience and what the common illnesses they experience. Yes. So this is an important thing. Who should provide DSM? who. So this is again, I have mentioned one picture here. Basically, first, that is a diabetes education has historically been provided by nurses and dietitians. Definitely. Previously, we can do only nurses and dietitians, but now the role has been changed. That is expanded role. Expanded role in that registered nurses, then registered dietitians, or you can say registered pharmacists. They can give the this DSME education to the diabetic client. So this is the hierarchical triangle I have mentioned here. So you just see non-healthcare professional in the base, then after healthcare professionals, non-diabetes educator, then after non-credential diabetes educator, and then credential diabetes educator, and then advanced level diabetes educator, or you can say clinical manager. So next, credential diabetes educators are healthcare professionals whose practice focuses on educating individuals at a risk for diabetes to become effective self-management. Credential diabetes is, they are educators, but they have taken some kind of education, some kind of a training, which they can provide the knowledge. Okay, so this is important, and because of this, what they expect from the people, diabetic people, in-depth knowledge and skill derived from the biological and social sciences, communication, counseling, and education also, and then extensive diabetes management. When to provide DSME? So this slide I have mentioned here, according to American Diabetes Association, they have mentioned 4 things here when to provide DSME. That is at the diagnosis, second, annually, and third, when new complications factors influence self-management, and fourth one is when transition in care occur. So they have mentioned 4 critical times to assess, provide, and adjust diabetes self-management, education, and support. So when to provide this according to American Diabetes Association, they have mentioned like this. But right now we are not practicing in our scenario. But this is actual thing we have to keep in our mind. So at the diagnosis only, we have to start to give the health education or the self-care management to the patient, diabetes patient, and it would be helpful for the benefit. It would be benefits for the patient also. So 4 things, that is at diagnosis, annual, and then new complication factors, and the 4th one is a transition in care occur. So there are certain barriers. If there are barriers, so what are the barriers? Lack of knowledge and skill. If the person doesn't have any knowledge and skill, how he will do or how he will take care of himself or herself, that is important thing. Then lack of resources. Resources are if not available. So again, this would be the barrier only for self-management. Then money for medication. If the person is belongs to a very poor family, how he will manage with his or her medication? So there will be barrier. Then after, lack of social support. Social support in the society also, as well as in the community, as well as you can say in the family also. If the family support is not there, family care is not available, so definitely the patient feels very sad, and patient feel very he will go in deep thinking, that is, I'm not getting cured, so this problem will be with me only. So what not, the many questions has come in their mind. So lack of social support. Then after, attitude of a health professionals. If the diabetic person goes to the healthcare professionals, and the healthcare professional is not allowing or is not showing the good approach towards the patients, definitely this will be very bad thing for us, because of we have to conduct all these kind of programs, and we have to provide the good education to the client, so they can improve their life and they can modify their lifestyle. Modifications are there. Then after, access to laboratories. Definitely patient should have the easily access available to the availability of laboratories too, because as a diabetic person, they have to check their blood sugar level regularly. Then after, last one, that is a knowledge of a health professionals. Definitely it depend on knowledge also. the healthcare professional, if he or she doesn't have any knowledge, then how they can provide the good self-care management to the patient or to the client. This is again one of the barrier in the self-care management. So these are the certain barriers. Now there are strengths and weaknesses also. Strength and weaknesses in that, in the strength, you can see here, strong primary care teams and potential for team-based chronic disease management programs. Weaknesses, large uncontrolled diabetic population. It's a real thing. We cannot control. There are means in our population, a large uncontrolled diabetic patients are available, and they have a lack of team-based chronic disease management even program also. We don't have that actually. Then again, lack of chronic disease management programs to improve patient outcome. Because of population only, the problems has been there. A huge population we have, and in that huge population, many peoples have suffering with this condition. So this is very strange thing we cannot manage easily. So these are the two weaknesses are here. And then threats. What are the threats? No established nurse-led disease management programs. Definitely we don't have that. Actually, we have to improve in that. Then lack of structured diabetes management program. So there is a certain lack of diabetes management programs are, I think nowadays it is there, may be there, but exactly the policies, the rules, all the things included in the diabetic management program, then only it will run easily and it will be helpful for the, or it will be benefited for the patient. Okay, so these are the strength and weaknesses for the DSM. Then take home message, that is DSME is an ongoing process and complex activity of facilitating the knowledge, skill, ability necessary for diabetes self-care. Just I have explained, because three things are important here: knowledge, skill, ability, which improve diabetes self-care. Then to know 4 critical times for refer DSME program, that is at the diagnosis, annual assessment should be there, new complicating factors ahead, and then after transition in the care. These are the 4 critical times to refer the diabetes program. Then after, not every education have a benefit of DSM. So what are those? Address social determinants, link to community resources, engage family members, teach self-regulatory skill, provide education on lifestyle change, provide support for lifestyle change, use telehealth if when needed, use individual or group education, and then use peers for ongoing support and create management team. So these are the, means not every education have a benefit of DSM. So empowerment of a self-managed diabetes, means this is important thing which I want to share here, because of this program, the DSME program, we can learn many things and we can give the good education to the people, diabetic people, and they can improve their lifestyle. They can work on their, what to say, physical activity. Then whatever bad habits, that means smoking, alcohol, they can stop. Means, but the proper guideline we have to provide them. Then address psychosocial issues and behavioral strategies. This is again very important. We have to very politely we have to give health education to them, and we have to understand the personality of the person, because every person has a different personality. Some people, they can accept, yes, I'm suffering with this condition. Some person, they don't accept, because they don't accept because they think, okay, fine, this is blood sugar level increase. No, okay, fine, I will take medication one time and then I will be cured. No, it is not. It is not happening. It is not everybody's cup of tea, because this is very important thing. We have to accept the things first, then only the cure rate is very high. So address the psychosocial issues and behavioral strategies. Then after, partnering with a diabetes educator to improve patient's outcome. Okay, means as a peer group, or you can say group discussion or group education is very important again to improve the patient's outcome. Then peer support can help patient on motivations and skill. Definitely. In the peer education, you will have the good knowledge from the peer supporter, or you can say peer group people. They can talk with each other, and they, because of them, you will have a motivation and you can develop the skill also. So I think this is a last slide. Thank you so much. If you have any doubt, you can ask me, no problem. I think this is very short slides, only 25 slides I have made. The things which are very important, that only I put up here. So anybody has any doubt in this?
Yes, anybody is having any doubts, please ask, ma'am. You can stop sharing your screen, ma'am.
Yes, yes, yes.
Yes, anybody has any doubts? If you have any doubts regarding the SLD, you can even ask. Yes, Silpa ma'am. I
Yes,
think they
I
don't
guess,
have any doubts, I think.
I
Till
guess
this is the
nobody has.
last session, and even till last session you don't have doubt. That means everybody is good. I hope everybody have understood all the sessions. All of you are diabetes
For whole 10
educators.
session, they don't have any doubts, sir.
I guess there are no
Good
doubts
session,
from the
really.
audience. The
It was
participants
really
are.
good session. Only thing what you have to make patient more serious. Self-education means patient should become serious about the complications. Already we have seen the disease progression, like right from progression causes till what they have to do. So major thing is that they should become serious. And if they don't become serious, you have to make them serious as a diabetes educator. You have to give some fear to them that if you don't do this, this will happen. If you don't control blood sugar level, you are going to have kidney failure. Okay, within 5 to 10 years, there are like many complications. At least like you should make them fearful if they don't become serious. And if they don't become fearful, serious, then definitely complications will have problems. If they don't become serious, then like you have to control diabetes. Don't allow diabetes to control you. And first thing is,
Yes.
I think Dr. Vishal sir is doing PhD on that, pre-diabetes and even diabetes patients. If you really control blood sugar level, you can prevent many complications. And there is a term called as diabetes reversal program. Actually, you cannot say reversal. You cannot reverse diabetes as such. It is a remission. Okay, remission means what? You can control blood sugar level, or you can even stop medications with lifestyle modification. That's Swati madam discussed just now, like lifestyle modifications, exercise, diet control, sugar, like all that is really important. With that, you can really live very good quality of life. And the patient, like if you don't control, 5 to 10 years you are going to die. Or if you control, I have seen many patients, those they can live longer, more than 30, 35 years without any complications. Very good control of sugar. That should be the aim of diabetes planning. And self-education is like many important. Self-management. It is like you are managing your own diabetes with the help of like knowledge and like doctors consultation or diabetes education consultation. Very good, Swati madam. It was very nice session. Shilpa madam,
Thank you.
over to
Yes.
you.
Thank you so
Thank you. Thank you, Dr. Praveen sir, for adding some knowledge on the topic. And thank you, Swati madam. It was really a knowledgeable session. And I personally feel that we were very enthusiastic in listening to your session, and we were deeply connected to the session also. And thank you
Thank
for
you, ma'am.
imparting the knowledge. I feel that the session was really very, very important. And we see that nurses' role is not only restricted in the hospital, but it is restricted to the, but we can also work with the patients or with the diabetic individuals in the community outside. We can educate the people who come to OPD, we can educate them about how to prevent or how to control diabetes in various ways. So that was very, very essential, and every nurse can become a good diabetic educator after this successful completion of the project. Now I request this one, Bellani, Govind Bellani, who is going to present a case on the same. So I welcome Mr. Govind Bellani, who is the staff nurse of Bharti Vidyapeeth, and I give the session to him.
Yes, Bellari, you can share your screen now and you can start your case presentation.
Yes, sir. Yes, sir.
Hello, Mr. Govind. Hello.
Yes, Govinda. Yes, yes. Here.
Govind, are you
Yes, sir.
ready?
Yes, sir.
Okay.
Yes, sir.
Okay.
You can make it as a slideshow, Govinda. Yeah,
Yes, sir.
yeah, yeah. Okay.
Can I start, sir?
Yes, yes. You can start.
Good morning, everyone. Myself, Govinda Ballari from Bharti Vidyapeeth, Sangli. I will be presenting a case. First of all, we shall see the patient information. It is Mr. X, of 64 years male, from Gurgaon, Buikarmala, Tasgaon, was admitted on 2nd May 2024 at 9 a.m. in Bharti Hospital, Sangli. His key complaints were difficulty in managing blood sugar level. Patient reports frequent hyperglycemia, adherence to medication. He experiences of frequent urination, and occasionally blurry vision. Diagnosed as type 2 DM HTN. Known case of DM since 5 years. His medication history: tablet metformin of 1000 mg per oral, that is taken twice in a day, as it belongs to the class biognide, which helps to control the blood sugar level. Then tab lisinopril of 5 mg was taken once as it belongs to the class of angiotensin converting enzyme, that is AC inhibitors, to treat high blood pressure. Family history: patient had a significant family history as his mother was known case of DM. Social history: that is sedentary lifestyle, high stress job, inconsistent meal patterns. Patient consumes the processed foods and limited physical activity. Lab investigations on admission, that is on 2nd May 24, that is hemoglobin is 13 gram per deciliter, white blood cells 5,100 per cubic millimeter, platelets 3,44,000 per cubic millimeters. Potassium, that is 3.5 millimole per liter. Sodium was 145 millimole per liter. The random blood sugar level was 350 milligram per day. On the next day, PSL fasting was 160 milligram per deciliter, HbA1c 8.5%, and cholesterol levels, that is total, was 210 milligram per deciliter, LDL 130 milligram per deciliter, HDL 40 milligram per deciliter, and triglyceride 200 milligram per deciliter. On admission examination, that is, first is vital signs: the temperature 98 degree Fahrenheit, pulse 94 beats per minute, respiration 22 beats per minute, blood pressure 160 by 90 mm of Hg. On general appearance, patient appeared overweight, that is weight 95 kilogram, height 175 centimeter, BMI 31 kilogram per meter square, and belonged to obese class 1. On systematic examination in cardiovascular system, patient presented with sinus tachycardia, no murmurs or any abnormal sounds. In respiratory system, mere breath, no cough and wheezing. Gastrointestinal system, on palpation, abdomen was found soft, non-tender. On auscultation, all sounds normal. In neurological system, conscious and oriented. In musculoskeletal system, range of motion, upper and lower extremities with no joint pain. In integumentary system, palpable peripheral pulses with no rash or itching seen. In medical management, it is involved crucial and immediate actions to lower the sugar and prevent complication. First, we shall see first what has been done in crucial and immediate therapy. A stat dose of injection regular insulin bolus 10 units of dose diluted intensity NS was given intravenously. That is, regular insulin is a short acting with onset of action of 30 to 60 minutes. Injection pantoprazole of 40 mg given once a day as it is a proton pump inhibitor. Tab metformin 1000 mg was given twice a day as it belongs to class biguanide, which helps to control the blood sugar level. Tab lisinopril of 5 mg was given at HS, that is night, as it is the angiotensin converting enzyme inhibitor, antihypertensive. Tab lipicand of 10 mg per oral, that is given at HS, as it is an antiplatelet drug with class statins, helps to lower bad cholesterol and prevention from cardiac disease. Continuous glucose monitoring is done every 6 hourly. Intravenous fluid IV NS was administered to prevent dehydration resulting from hyperglycemia. Patient education about the importance of adherence to their diabetes management plan, including medication, diet, exercise, and regular monitoring of blood sugar levels. Prevention of its complication, as it is crucial for individuals with diabetes to seek medical attention promptly if they experience persistently high blood sugar levels, as untreated hyperglycemia can lead to serious complications such as diabetic ketoacidosis or hyperosmolar hyperglycemic state. In nursing management, the goal involved monitoring, medication administration, and patient education. In monitoring, first we shall monitor the vital signs. Next is blood glucose monitoring every 6 hourly. In neurological status, we should assess for the conscious and state oriented level, and fluid intake and output should be measured. Sign of dehydration or electrolyte imbalance should be assessed. In medication administration, prescribed medications as ordered by physician, that is insulin administration and oral antibiotic medications. Patient education that emphasized the importance of medication adherence. We should tell that how much important, what are the importance to take the medication and its benefits, and self-monitoring and lifestyle modifications. Now, diabetes self-management educational plan on discharge. First is assessment, that is evaluate patient's understanding of diabetes and its complications. Assess its current self-management practice, including diet, physical activity, medication adherence, and blood glucose monitoring. Then is identify barriers to effective self-management, such as knowledge gaps, lifestyle constraints, and psychological factors. In goal settings, short-term goals, that is achieve blood glucose levels within target range, improve dietary habits, initiate regular physical activity. In long-term goals, reduce HbA1c below 5.7%, maintain blood pressure below 130 by 80 mm of Hg, achieve and maintain a healthy weight in long-term goals. In educational plan, first is nutritional education. That is what first is collaborate with a registered dietitian to develop a balanced meal plan focusing on whole grains, lean proteins, fruits and vegetables. What all whole grains should be taken advice from the dietitian, that is whole grains such as brown rice, fruits such as we should take apples, blueberries. We should take the guidance from the dietitian. Then teach carbohydrate counting and portion control. Means what? Means how much carbohydrate should be taken, what amount it should be intake should be there. Then encourage meal planning and preparation to avoid processed foods. Processed foods should be avoided. Processed foods means just the foods which have been cleaned, washed, or pasteurized. Such foods should be avoided. In physical activity, advise at least 150 minutes of moderate intensity aerobic activity per week. For example, brisk walking. Brisk walking in the sense means yes, walking should be done of 13 to 15 minutes, but in that the pace is not needed. How much speed we are doing. But exactly at least once 13 to 15 minutes, the walking should be done. Then include resistance training exercise twice a week. Develop a gradual exercise plan considering patient's current fitness level. Means before developing exercise plan, we should see for the current status of the patient's fitness levels. Then according to that, we should develop a gradual exercise plan. Then in medication management, reinforce the importance of medication adherence, educate on the correct timing and dosage of medications. You should tell the patient to take the medication at the correct time and discuss potential side effects and in the importance of regular follow-ups. Blood glucose monitoring and teach proper techniques for self-monitoring of blood glucose. Establish a monitoring schedule, for example, fasting, pre-meal and post-meal readings. Use self-monitoring blood glucose data to make informed decision about diet, exercise, and medication adjustments. This is one of the slide that is of self-injection of insulin. With one hand, stabilize the skin by spreading it or pinching up a large area. Pick up syringe with the other hand and hold it as you hold a pencil. Insert needle straight into the skin. To inject the insulin, push the plunger all the way in. Pull needle straight out of the skin. Press cotton ball over injection site for several seconds. Use disposable syringe only once and discard into hard plastic container, such as an empty bleach or detergent container. Next is stress management. Introduce techniques such as mindfulness, meditation, or yoga. You should ask patient to do the meditation or yoga. With that, if patient can decrease the stress level, discuss the impact of stress on blood sugar level. As due to stress, the blood sugar levels are increased due to the release of the hormones as in response to the stress. Then problem-solving skills, develop strategies for managing high or low blood sugars, and encourage patients to recognize patterns in blood glucose readings. In follow-up, schedule regular follow-up appointments to monitor progress. The schedule should be made to look after the blood sugar levels, how the sugar level is increasing or decreasing day by day. To monitor that, schedule should be made. Provide continuous support through phone calls, emails, or diabetes support groups. In evaluation, assess changes in HbA1c, fasting, and postprandial blood glucose levels, blood pressure, and weight. We should assess for all this. Whether how much it has been decreased or how the range of the blood sugar level is maintaining. Then evaluate adherence to the DSME, that is plan and make necessary modification. Now we shall see the progress and results that is after 1.5 months of adherence to the self-management education plan. Mr. X showed improvements in various health parameters. Its first is glycemic control. His HbA1c levels dropped from 8.5% to 7.3%, indicating better long-term blood sugar management, and BSL was in range of 130 to 140 milligram per deciliter. He experienced a modest weight loss of 2.5 kilograms. In cardiovascular health, his blood pressure and lipid profile showed favorable changes, reducing the risk of cardiovascular complications associated with diabetes. In mood and well-being, Mr. X reported reduced stress level by doing meditation and yoga. Last is conclusion, that is diabetes self-management education is essential for patient to gain better control over his diabetes. Through individualized education and support, patient can improve his self-care behaviors, achieve his health goals, and reduce the risk of diabetes-related complications. Regular follow-up and continuous support are critical for sustaining long-term improvements in his health. Books referred, that is Joyce M. Black of Textbook of Medical Surgical Nursing, Bruner and Sudhar, Textbook of Medical Surgical Nursing. Thank you.
Thank you, Mr. Govind.
Yes.
That was a great and excellent case presentation. Thank you for taking efforts and imparting knowledge. Now,
Thank you, madam.
I request everyone to fill the feedback forms. I request we give you
Before the
10
feed-
minutes.
Before
Yes.
the feedback form, I have mailed the post-test link.
Okay. There's a post-test link also. Madam,
Yes, ma'am, I have already mailed that.
mail
The
it.
participants will receive the post-test link on the registered email address, ma'am.
Okay.
So you have a link
But
in
so
your
they have to
registered.
appear for test first and then
Yes,
feedback.
yes, yes. Before
Post-test.
submitting the feedback form, they have to submit the post-test also.
Okay.
Yes, we will give
Pooja
them
ma'am,
5. Yes, sir.
can we share that post test link in the chat box?
Chat
No,
box.
sir,
No?
it is not
Okay.
possible.
Yeah.
We have done on the, like, it is unique one, na?
The process.
We cannot
Okay.
share that.
Okay, it's
The
okay.
process is like that. So it is shared in your email, the registered email
Yes,
with
yes, yes.
Eco
I have
India.
shared.
So please go back to your mails and check the link for the post test, and please fill the post test before you fill the feedback sheet.
And
Right.
kindly tell me that if you have received or not.
Okay. If somebody has not received, you can tell it right here.
Yes, you can give me your email address. I'll send you separately.
Yes.
If you have received, just give me a thumbs up. This, yes, you have received the post test link.
All participants, please check your mail. If you not received, please drop your email ID in chat box so that madam will send you separately.
Okay, thank you, Deepak brother, for the thumbs up. And who else has received? If you have received it, give us a thumbs up. Yes, thank you, Jyoti sister. Anybody else has received?
Yes, yes. Thank you so much. And I'll be posting the feedback link also in the chat box. Kindly fill that also.
Those who received post test link, kindly answer the questions. Start answering.
Thank you, Ganesh brother. Those who have not received also send us a mail.
Yes,
Here
yes.
on the chat, here on the chat box, you can send your mail that you have not received it, and we will send it back. We will send the link to your mail.
I think Pooja madam, it will be better if they share their mail ID also. If they have not received.
So yes.
In chat box, if they share their mail ID.
Yeah, they can share their mail ID on the chat box. I'll
If you have not
give them.
received.
Yes, sir. And I have also posted the feedback link also. From last 2 to 3 sessions now, sir, we are getting very less feedback.
Less
We have
feedback.
got only 12 or 11 feedback form.
Participants were only less. Last 2-3 sessions, like very less participants were there.
Yes.
What about Sairantri, Mallikarjun, Sulochana, Anju sister? Have you received?
We have not received any like posters till now. Maybe they are filling that.
Only that will be.
Just we'll give them 10 minutes.
Yes.
Okay.
Meanwhile, we can do the like validatory sessions if there is anything. We can do that.
Yeah.
Already we finished that. Like I asked madam to start with a little session only because she had to go. Anyway, it was really nice program, and I thank Eco India. A special thanks to Vishal sir. So technically, he managed
Yes,
everything.
sir.
Thank you, sir.
Technically, I can say that he's part of Eco India now. We have a person from Eco India plus Vishal sir from College of Nursing. Madam, like, can we have programs like henceforth also on our own? We can manage such programs.
Sorry, sir.
No, I like your collaboration is required all the time for all programs. Can we have separate sessions with eco platform?
For the discussion,
Yes.
debriefing.
No.
Yes, sir. After this session will complete, now the hub
Yes.
team members will have a discussion with the eco.
Okay.
So we will be going to tell you that how the session will has gone and what are the
Okay.
drawbacks of that and what we can
Okay.
improve that. Now we will have a discussion.
Okay,
So
we'll have a
after this,
discussion
na,
on
yes, sir.
something. Yes.
Yes, sir. Yes. And participants, please note that it will take 15 to 20 days to issue the certificates. Okay.
For certificates, like whether we have to share from our side signatures and names.
So that will be done by you can ask the Albin sir about
Yes,
that.
yes, yes.
Okay,
I
or
asked
I
Albin,
will
sir.
tell you afterwards that, na?
Yes, yes. We
We'll
will
ask
share from our
them.
side.
Sorry, sir.
We will share the names and signature from our side.
Yes. We want the hub team members' name, the speaker's name, and the case presenter name from your side.
Okay. So even case presenter also will get separate certificate.
Yes, sir. He will
Very
also,
good.
the person will get the certificate of the case presentation. If the participant have filled the form, post-test form, just give me a thumbs up that yes, you have filled, because we have not received any one, like even a one post-test we have not received.
Those who have filled the postage form can send it back.
Yes, I'll be sharing. Just wait.
Don't forget to submit at the end.
Yes, I have sent that. Once again, I have sent that. Yeah. Done.
Sangli staff, please fill the assessment, post-assessment form.
If anybody has not received the post assessment form, please tell us in the link that you have not received it. Because we need all the post assessment forms.
Vishal sir, can you please check, because in my laptop it's showing that 0
Yes, ma'am, just a minute.
candidates.
There was a error in loading the page, ma'am. Just a minute. No, Pooja, ma'am, no, still no one has responded. Please, dear participant, please respond the post-test assessment form.
We have 30 participants here, but no one has filled that form. Is it too long?
Only 15 questions we have.
Yes.
Ganesh, Govinda, John, Jyoti, Mallikarjun. Deepak, Divya, Divya Shetty, Arbaj.
Thank you, Shriramji, for your excellent words. And
Now we got three forms, I think, three responses we got to them.
So today, it's like we have come to the end of the session today. You please fill the post-test form. I would just like to summarize the program till you fill the form. We have started this program on 3 months back. Every Friday we have taken program from 2 to 3:30 p.m. That was nearly for 1.5 hours, and we successfully and smoothly have run the project for the 3 months. We have finished the topics on basics of diabetes, then medical management of diabetes. We have finished with insulin therapy. Also, we have done with acute complications of diabetes and its management, chronic complications of diabetes and its management, diabetic neuropathy and food care, dietary consideration, exercises in diabetes, monitoring of diabetes, and diabetes self-management and education. So we have covered the whole of diabetes and also about the care or self-management of diabetes. I really thank all the lecturers or the speakers who have given us their precious time and imparted knowledge to our nurses to become nurse educators of diabetes. Today is the last day. I would like to thank Eco India who collaborated with Bharati Vidyapeeth College of Nursing. I also like to thank Madam Nilima Bhore on behalf of medical surgical nursing team. My sincere thanks goes to Dr. Nilima Bhore, who is the Dean, Faculty of Nursing and Principal College of Nursing, Sangli. She is truly an inspiring person, and she always gives us opportunity to do new things and to collaborate with new teams. I would also like to thank our leader, who is the head of department, Dr. Praveen Nani sir, who is truly an inspiring person and who always inspires us, he guides us, and he valued our team so much, and he gave us opportunity here also with the team of Eco, and we learned so much about the care of diabetes and some new things, the consequences and how to prevent diabetes. And the project really ran very smoothly throughout these 3 months. And we did not, I feel that we did not face any problems. And it was really a nice collaboration with Eco India. I extend my thanks to medical surgical team who have taken part, who took efforts to make this program successful. And thank you, Pooja madam, who was always there to help us, motivate us, and she helped us a lot throughout the presentations. If we had any problems, if Vishal sir had any problems, she would ask her, and she was a very good connection with Bharti Vidyapeeth from the ECO team. Thank you very much.
Thank you to the Pune College of Nursing, Medical Surgical Nursing Department, even Navi Mumbai College of Nursing, Medical Surgical, Dr. Gargi, Dr. Ranjana Madam, and staff nurses especially, and even the Yerwade Madam from Bharti Hospital, Sangli. She agreed that she will give at least 15 to 20 participants, and she like really made them to register for these sessions. Even thanks to the matrons from both the hospitals, Pune and Mumbai.
I hope everybody is still filling the post test and the feedback form as well.
Yes, we have received only 4 post test and 5 feedback. Participants, please note, if you will not going to fill the post test, you will not going to give, we will not going to give you a certificate.
Certificate.
Yeah, very sorry for that. If you'll Sir, can we take a post session picture? Kindly switch on your cameras. Can you please participants switch on your camera? We can have a post session picture or a post program picture. Suraj, can you please switch on your camera? Divya, Vishal, Pratiksha, Divya Shetty. All the participants are requested to kindly switch on your camera. Deepika, Prajakta, Nivedita, can you please switch on your camera? Jyoti Desai, Divya,
This is the last time.
Yeah.
Henceforth, next Friday onwards, I'm not going to ask you.
next Friday we will not going to disturb
Ah,
you.
that is there.
Can we have more videos on? Pratiksha, can you please switch on your camera? Mitali, Prajakta, Divya,
Now we can see faces,
yes.
smiling faces.
Yes, we can say that, sir. Okay, thank you so much, participants. And till now we have received only 8. Yeah, 13 we have received the posters.
Post-test.
13, 11, sir. We have received 11 and 7 post feedback.
Feedbacks.
Kindly inform your friends also. Those who have not attended today's session, please inform that to fill that form also because it is mandatory for certification. So, sir, can we wind up?
Yes, yes. Still, like even if we wind up now, and then they can continue filling the forms.
Yes,
And
yes,
post-test,
sir.
post-test,
Post-test also.
Post-test.
Same with the post test, sir.
okay, okay.
They can fill.
So give them some time, at least half an hour. Because
Yes,
they may
it's
be
okay. They can
in-
fill like we are giving them time.
Okay, okay.
Okay.
Okay, then we can wind up. Thank you, madam.
Yes. Thank you,
Thank
sir.
you, Pooja ma'am.
you,
Thank you,
Vishal
Praveen
sir.
sir. Thank you, ma'am.
Thank
Thank
you,
you, Shilpa
Praveen.
madam. Swati ma'am, Govinda for today's case presentation. Thank you, all of you.
Yeah, thank you.
Yes, Pooja ma'am, can I end this now?
Yes, sir. Yes.
Okay,
Yes,
okay.
you can end the session.
Thank you all the participants from the Pune, Mumbai and Sangli.